over the asthma drugs, bronchodilators, and anti-inflammatories. And as you can see, there's a little line going through the whole, going through it. I'm going to do everything in blue. So you get the line going through, the bronchodilators are up above, and the anti-inflammatories are down below. We have not only drug names, but you also get class names. So we're going to have to make sure we go through all of that. Let's start with the bronchodilators. Up here, you've got the praying hands and the guy with the trap. Now, everything's in blue that has to do with drug, the drug name. Red is adverse effects. Okay, so the first one, and then in black, we've got the class that there is, so we can do a little bit of a highlight. This right here is the class. And if you didn't know, it's an anti-muscarinic. See, 3 musketeers, 3 anti-muscarinic. So these are the anti-muscarinics. You've got I pray to them, or I pray to them, or I pray to them. I'm praying. I pray tropium. Ipratropium. Okay, now that is this particular drug right there. That is a bronchodilator. That's an antimuscarinic. Over here is TIO, his name. Not T10, it's TIO. TIO is trapium. So tiotropium. Tiotropium and Ipradium, and they're antimuscarinic inhibitors. The adverse effects is 0 pointing to the mouth, 0 stomia, dry mouth. The eyes are in red, interocular pressure. The throat has got some throat irritation and GI upset. So those are the adverse effects. These are antimuscarinic receptor blockers. They will help with bronchodilation. Over here, we've got the felines, and it is a methyl Z, or methyl xanthine. Methyl Z, that's how I'm going to remember it. That's kind of what we're looking at, methyl Z. This is Theo. Theo is on his tag. Oh, it's a pretty big tag for a kitty, but theophylline. Ran out of room. Theophylline. Also aminophylline. So it's the cat. So the felines. Okay, so you're gonna look at the. And those are bronchodilators. They're part of the methylxanthine group. And the adverse effects are headache. That's what the lightning bolt to the head is. GI upset, heart palpitations, and tremor is with the motion around the legs. So you get tremor, GI, heart palpitations, or headaches. Okay, another bronchodilator is in this area right here. This is the beta adrenergic receptor agonist. So it's a beta agonist. It likes the bats. The bats are the beta 2. So there are 2 wings, beta 2. Okay, so I like the bats. He's also saying I'm in terrible pain. Terrible pain is the terbutaline. 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 Also, it's pointing to his butt, albuterol, however I remember it, albuterol. It's all part of the beta 2 agonist. They like that. The side effects are usually with overdose. You got tachycardia, palpitations, things to do with the heart, anxiety, but you also have a whole bunch of suckers, so that's increased hypoglycemia. You got tremor, and you also have decreased PIGs, or decreased potassium, or hypokalemia. Those are the side effects for the beta-2 agonists, all bronchodilators. Okay, so done with the bronchodilators, let's go down to the anti-inflammatories. Right here you've got Luke, who is, he's playing hockey, so we're going to just, that's my nephew, so we've also got Luke playing hockey, and he's got a cast on it, so it's a leuko cast. Leuko's in a cast. Okay, and so what this is going to do is stop the leukotriene. So it's a leukotriene blocker. Okay, leukotriene inhibitor. And they all end in L-U-K-A-S-T. L-U-K-A-S-T. So it's a leukocast. It's either monteleucocast or zephyrleucocast. So it's the leucanocast, and it's either zephyr or monte. Now these stop with they block the receptor for leukotrienes. There's also one that stops leukotriene synthesis, and that's the Xylutin, which is actually discontinued. So I don't think you're going to have to know about Xylutin, but you definitely need to know about the leucasts, which are leukotriene inhibitors. They also affect the P450. Whoops, we're moving on to adverse effects. Flu-like symptoms, so fever, headache, there's a headache, just not feeling good, GI upset, so there's GI symptoms, and they do inhibit the P450. Okay, another anti-inflammatory. Oh, wait a minute. I'm kind of on this yellow business. And leukotriene inhibitor, so it's a blue. Over here we have the become as one. See, they're getting married. Become as one. Anything that can get into the name. So you've got beclomethasone. Become as one. Beclomethasone. Alright, these are the corticosteroids, so cord of the stereo, corticosteroid. I know, it just works. So that is the class that they're in, corticosteroids, beclomethasone. The adverse effects, I was going to put this on the bride, but either way, can get increased blood pressure, Cushing's syndrome, there's a Cushing, diabetes, PUD, which is peptic ulcer disease. Those things can come up with beclomethasone use. Another anti-inflammatory is the mast cell stabilizers. So you've got the mast there. That's why the arrow is going to the mast. These are the mast cell stabilizers. And this is the chromium C. So you can say a mast and a cell in the chromium C. Chromalin. And I'm thinking also crow, so you got the crow, a new chrome. So there's another name, nedochromyl, Ned the crow here, Ned. And that's nedochromyl. And these are the mast cell stabilizers. There's the mast. And so the adverse effects I put on this crow, I know it looks more like a pigeon. Cough. Dysgeusia. Dysgeusia is actually a bad taste in the mouth. That's why the tongue's there. You've got nausea and vomiting. So those are the adverse effects of chromalin or nedochromyl. So keep those things in mind. Bronchodilators, anti-inflammatories.